A Heroes Work Here sign greets employees entering the Holliswood Center for Rehabilitation and Nursing. For the past 2 months, they have been the sole face-to-face contact for the center's nearly 300 patients after the doors were closed to all visitors to prevent the coronavirus from spreading here.
I think that it was a shock to all of us that coronavirus I felt like sneaked up on us, even though we knew about it. We were preparing, and I know I was educating staff on corona and what was going on and what we were expecting. And I think within a week, so much changed.
Annmarie Ramos is the center's director of nursing. She said enforcing the protections was a huge challenge initially.
Notifying family members that they weren't going to be able to come anymore. They were angry because it just kind of happened. Speaking to the residents and explaining to them that their loved ones weren't going to be able to come.
Still, the virus came calling, killing at least 57 people, a number that Ramos says reflects residents who died in-house as well as in the hospital. She calls residents extended family and says their deaths have taken a toll on employees at the home.
I don't think that people understand that as much and see that concept, that when we have a death, so many people are affected besides just the family that are experiencing this loss.
Ramos says some of the 57 people who died, she did not have an exact number, were COVID-19 patients who had been transferred from hospitals under a controversial state policy enacted by Governor Cuomo, requiring homes to take them. However, Ramos was careful not to blame the policy for the virus spreading through the Holliswood Center. Last week, Cuomo changed the policy. Now hospital patients must test negative for the virus before they can be admitted to a nursing home. In addition, nursing home staff must now be tested for the virus twice a week. Ramos says as the number of hospitalizations decreases, she hopes the focus will shift to nursing homes.
We just want the same support that he gave the hospitals that worked out really great. You see the numbers are decreasing. Now let's start sharing that with our nursing home family. Let's have that same regional approach.
An approach she hopes will keep this vulnerable population safe. In Queens, Clodagh McGowan, New York 1.